Now we have come to our main agenda. We will have two speakers from Korea to share on COVID-19 risk perception and loneliness among Korean adults, the mediating effects of social distancing and social connectedness. Professor Soondool Chung is a professor in the Department of Social Welfare at Ewha Women's University. She is going to present. And also Dr. Ahyoung Lee is a research professor at the same university, and she received her PhD in social work from the University of Texas at Austin. So now let's welcome both speakers.
So good afternoon, everybody. Yeah, as Lo introduced us, today's presenters are two. I and Ahyoung Lee will present the titles COVID-19 risk perception and loneliness among Korean adults. In this context, we will investigate the mediating effect of social distancing and social connectedness. I'm very happy to be here and share our research findings related to COVID-19 with you. I will briefly talk about that background of this research, and then Dr. Ahyoung Lee will present the situation of COVID-19 in Korea and research models and findings. 3 years ago, researchers from Hong Kong, Japan, and Korea gathered together through Zoom meeting and discussed to collect data, which will contribute to understand the corona situation and cope with COVID-19. From February 2020, with the outbreak of COVID-19, there are lack of data concerning COVID-19. So we three researchers decided to compare the situation of COVID-19, middle-aged people and older people, how they perceive COVID-19 and what strategies were used to respond to the pandemic. We developed questionnaires and collected data. At that time, I have decided to collect more data to compare younger people and older people. Therefore, in Korea side, we added younger people data. Today, we will present comparison with the three age groups: younger people and middle-aged people and older people. Yeah, so now Dr. Ahyoung Lee will present the details. Thank you.
Okay, good afternoon, everyone. And thank you for Dr. Lau for having us. And this is so nice opportunity to present our work here. Okay, I like it. So this is the table of contents. So I'll start with giving you some background information about COVID-19 trends in South Korea. So this graph shows COVID-19 daily new cases from February 2020 to January 2023, which is just last month in South Korea. The peak in March and April 2022, you may be wondering what was going on, and that's when the Omicron variant were spread. The next one also shows that daily deaths, number of daily deaths from the same period, about 3 years period in South Korea. So a lot of people were affected by COVID-19. This is the most recent data published by, according to the Korea Disease Control and Prevention Agency, and it shows the current status of COVID-19 in South Korea. The COVID-19 confirmed cases and deaths have decreased. So now the government announced that we can get off from our masks, but still we are wearing masks because we got so used to wearing it. And there are some places we are required to wear masks, like public transportation or in pharmacies. So anyway, we are just wearing it. Next. Okay, so this one shows COVID-19 related statistics in the Seoul metropolitan area. Our research that we are presenting today was conducted from October to November 2020, which is the second period in the red box, when the case severity and fatality rates were the highest, and the incident rate of older adults aged 60 and over was higher than other age groups, like 56.5%. And during the COVID-19 pandemic, Korean government implemented a wide range of social distancing measures, such as social distancing, enhanced social distancing, and mitigated social distancing. So they announced every 2 weeks that which guideline we need to follow. And when our survey was conducted, strict social distancing measures had been applied in Seoul metropolitan area. To give you more idea about the social distancing measures we used, there were social distancing, which we were recommended to refrain from going out and to minimize contact with others. And they closed daycare centers and social welfare facilities. Also, when we had enhanced social distancing measures, we were required to postpone or cancel non-essential outings or gatherings, and we had to return home immediately after work. We couldn't go drinking after work and so on. And they suspended operating religious, sports, and entertainment facilities. And only non-face-to-face classes were allowed at private institutes, including universities, and banned visiting to nursing facilities and hospitals. So consequently, with all the social distancing measures during the COVID-19 pandemic, many people experienced loneliness due to this lack of social contact and social distancing restrictions. And previous literature shows that there are some mixed findings about who are most vulnerable to loneliness. Some scholars says older adults are more vulnerable than younger adults, and others say younger adults showed higher loneliness than their older counterparts. So it was not clear who were the most vulnerable population. And there are a series of possible factors of loneliness. And among those factors, researchers found that COVID-19 risk perception could be highly associated with loneliness. So for example, Koreans consider that COVID-19 was more dangerous than other illnesses or natural disasters. And many Koreans suffered from anxiety and depression. And especially loneliness was more prevalent among older adults, according to some previous literature, than other age groups due to their higher COVID-19 related risks with their age, which may include their risk perception to COVID-19. However, still there is insufficient understanding of the association between COVID-19 risk perception and loneliness. So that was what we wanted to know. And another factor of loneliness is social distancing. Social distancing was introduced to prevent the spread of COVID-19 in most countries, including our country. And one of strict quarantine measures was to close social welfare facilities for senior citizens, and it resulted in weakening their social connectedness and making them feel socially isolated. And previous research reported the mediating role of social distancing in the association between COVID-19 risk perception and loneliness. Another variable we focused on was social connectedness. And, oh, sorry. Oh, okay, sorry. Social connectedness refers to a feeling of belongingness within a social group, larger than your informal social networks like families and friends. And social connectedness from previous literature could alleviate loneliness, depression, and anxiety, so it can be a protective factor. And social connectedness mediated the association between dysfunctional interpersonal behaviors and psychological distress. So it was necessary to further study the role of social connectedness in the association between risk perception and loneliness. So incorporating all this previous literature and theoretical background, we wanted to examine the complex associations among COVID-19 risk perception, social distancing, social connectedness, and loneliness among younger, middle-aged, and older Korean adults. And specifically, we wanted to investigate the mediating effects of social distancing and social connectedness in these associations among the three different age groups. So this is our research model. This model shows that loneliness is associated with COVID-19 risk perception, social distancing, and social connectedness. And that social distancing and social connectedness mediated the association between COVID-19 risk perception and loneliness. Let me talk a little bit about our methodology. This study used a cross-sectional survey with a multi-stage quota sampling. So by age, sex, and residential geographic area with registered Seoul city residents. Data were collected from October to November 2020. Study participants included 1,000 younger adults who aged from 20 to 49 years old, 1,002 middle-aged adults who are 50 to 64 years old, and 398 older adults who are 65 and over. We collected data online for younger adults and middle-aged adults, and we collected data from older adults face-to-face, through in-person surveys. Let me talk about some of our measurements. COVID-19 risk perception, we asked 19 items. We used the 19 item measures to measure risk perception toward the COVID-19 pandemic. And sample items are, I think the novel coronavirus is more severe than the flu, or I'm more likely to get the novel coronavirus than other people. Those are the risk perceptions. We used the 5-point Likert scale from 1, meaning strongly disagree, to 5, strongly agree. Social distancing was measured with a 6-item social distancing subscale of preventive measures for COVID-19. And it had items such as avoiding public transport or avoiding crowded areas. So if they are practicing social distancing. Social connectedness, another mediating variable. We used an 8-item measure on a 5-point Likert response. And sample items were like, I do not feel related to anyone, or I catch myself losing all sense of connectedness with society. And the reliability was good. Finally, our dependent variable loneliness, we used the 3-item measure on a 3-point Likert scale from 1 to 3. And sample item was, how often do you feel that you have a lack of interaction with others? And Chromebox Alpha was good. We also had some covariates like age, sex, number of family members, educational level, total household monthly income, employment status, religion, and subjective health status that are important, that can be important affecting loneliness. For our data analytic plan, we applied multiple statistical methods, including descriptive statistics, ANOVA with post-hoc tests, and multi-group structural equation modeling. We used M+ and SPSS for all the analysis. So let's see our results. So first, this table presents socio-demographic characteristics of the total sample and also 3 different age groups. In total, respondents' mean age was about 50 years old, and females composed about 52%. And about 60% of the respondents were married, and the mean number of family members was 3.28. And most respondents had a high school or a higher level of education. And I also want to point out that we had let's see, where is it? It's okay. It's on the next slide. About 2/3 of the respondents had a monthly household income of less than $3,000 US, and about less than half of the respondents had jobs, and nearly 60% of the respondents had religion. The mean score of subjective health status was 3.28, which means between fair to good out of 5 points. And this was what I wanted to mention. Here you need to see there was very small number of people who lived alone among our older adults. You can find it here, but yeah, there were actually no older adults who lived alone. That was our sample characteristics. Okay. And this table presents the mean scores of the key variables and the group mean comparisons and the results of ANOVA. There were statistically significant age group differences in the mean scores of all the major variables. And quite surprisingly, a younger group showed the highest COVID-19 risk perception. Can you see 3.58 compared to 3.51 in middle-aged group and 3.44 from older group. And also for loneliness, younger group showed the highest level of loneliness. For social distancing, our older adults were practicing social distancing very well, so their score was the highest among other groups. And social connectedness, our older adults actually showed the higher level of social connectedness. And this one shows, illustrates the unstandardized path coefficient comparisons of the 3 age groups. The overall model fit was good, and there were 6 path coefficient differences among the 3 age groups. Groups with a numerical superscript 1, 2 shows that they are statistically significantly different from each other. So for example, the path from COVID-19 risk perception to social distancing was higher in the younger and middle-aged group than in older adult group. And the path from social connectedness to loneliness was higher in the younger and middle-aged groups than in the older group. So let me show you the figure by age groups. So the same figures, but by age groups. This one shows the results of younger age group. The COVID-19 risk perception of young adults influenced more social distancing, and it reduced social connectedness, feeling of social connectedness, and that increased their loneliness. For middle-aged group, it shows significant path from COVID-19 risk perception to social distancing, but it didn't significantly affect social connectedness. Rather, we see the relationship from COVID-19 risk perception that reduced social connectedness of middle-aged group, and that increased their loneliness. And finally, our older group, you can see the significant path from COVID-19 risk perception to social connectedness again, and then it affected their feeling of loneliness. And finally, this table presents the results of mediating effects I just mentioned of each mediator using bootstrapping. The path coefficient for 4 paths in the implied mediational chains were statistically significant for both mediators. For the younger group, we found 2 indirect effects of COVID-19 risk perception on loneliness. And for the middle-aged and older groups, the effect of COVID-19 risk perception on loneliness was fully mediated by social connectedness, as I just showed you from these figures. To sum up, the older group was more likely to practice social distancing and feel socially more connected than other age groups. And that was quite surprising to us. And younger people were feeling more a risk perception of COVID and loneliness. And the younger group had higher effects on the all paths that were in our figure on our model, from COVID-19 risk perception to loneliness. And there were 2 partial mediating effects of social distancing and social connectedness for the younger group. And the middle-aged and older groups showed a full mediation effect of social connectedness on the association between risk perception and loneliness. So findings of our study emphasize the mixed results that I mentioned in the beginning of the presentation. Younger adults experienced worse mental health outcomes during the COVID-19 outbreak than older adults. And some people said older adults showed higher levels of loneliness than other age groups. Our results showed that younger adults had higher loneliness. Also, it shows the importance of social connectedness. That's the key finding from our study, the importance of feeling socially connected. So a sense of social connectedness was an important protective factor, alleviating loneliness during the COVID-19 pandemic. And precautionary responses like social distancing reduced intimate social interactions, which lead to higher levels of loneliness. In terms of possible risk factors of loneliness, sociodemographic characteristics can be influential on loneliness. So it is important to target high-risk groups and implement effective coping strategies for mitigating adverse mental health outcomes like loneliness or even depression. And it is necessary to evaluate stressors like risk perception of COVID-19 and coping strategy like social distancing, social connectedness, and mental health outcomes like loneliness during and after, even after the COVID-19 pandemic. There are some limitations to note. This study has limitations with regard to the nature of cross-sectional design of data, survey data. And also we use the unidimensional measure of risk perception. So we may later use a multidimensional measure for risk perception. And the risk perception measure, it didn't have a good Cronbach's alpha, it was 0.60. So maybe later we can use better reliable measure. In spite of these limitations, this study emphasizes the importance of social relationships to cope with adverse mental health outcomes due to COVID-19. So health professionals should actively screen high-risk groups for COVID-19 related concerns like anxiety and provide psychological interventions. Maybe it can be virtual therapy and counseling when face-to-face counseling is not available, and some social services like case management and friendly visiting programs for older adults. It is also important to build trust in government agencies and health experts by implementing effective COVID-19 measures. And future research should examine other possible social determinants of mental health and the long-term effects of COVID-19 on individuals and society. I have some reference lists. And this study was conducted in the support of the National Research Foundation of Korea. And thank you for listening. Okay, thank you.
Okay, so we thank you, Professor Chung and Dr. Lee, for the insightful sharing. Now we are inviting audience who joined on site and on Zoom to raise their question. You may raise your hands and then use the microphone in front of you if you are coming on site. And for audience on Zoom, you're welcome to type your questions in chat room, and I shall read it out for you. Any questions from on site? Okay, you can use the mic. Use the mic.
Okay, thank you so much for your interesting presentation. It was so interesting. And the result was a little bit surprising for me because it seemed that the COVID-19 affected for young people's mental health more than the older people's mental health. Yeah, and I thought like living alone might be one of the risk factors for increasing loneliness. And according to your presentation, there was no one who lived alone among the older people. So how about the younger people? Did you compare the younger people living alone and younger people living with their family?
Yes, right. As I mentioned, there were no older adults in our sample that lived alone. And we think that affected higher level of social connectedness among our sample, among the older adults. About 30% of our participants among our young adults were living alone. So about a third of them were living alone. And for middle-aged group, it was higher. 43% of them were living alone. So that may affected this result because in this social distancing, they were not going out unnecessarily. So they could not meet their friends and family members. So that we think that affected our result.
Thank you so much.
Thank you. And any other questions?
Thank you. So thank you. Very interesting study. I noticed that almost half of the sample, regardless of the age group, they are unemployed. So is it a very special circumstances in Korea, or it's you purposefully select people who are actually, you can see here, they are not employed during the time of survey? Is it something special? I mean, even for those who are younger group or middle age group?
So, I mean, for our team, it makes more sense for younger group and older group because for older group, they may have retired, but for younger group, it's nowadays it is hard for younger people to find a job, to get a job, even with college degree. So and there are many people in their 20s and they may have no jobs, and that affected this high level of unemployment status. But I was not sure about the middle-aged group, maybe more like housewives, they are not employed, that made this number, but that's correct. For our younger group, it is really hard these days to find a good job.
Oh, it's a little bit surprise, you know. Okay.
The online panelist from the research company.
Oh,
So
I
yeah,
see.
the sample is biased.
I see,
Yeah.
I see. So in that sense, did you control all these demographics? I mean, when you do the past analysis?
Oh, yes, they were all included as our control variable.
I
Yes,
see,
yes.
I see. Okay. Thank you.
Thank you. And I think we have a question from Zoom. Zoom is saying, thank you for sharing the interesting finding that older people feel socially connected than other age groups. So what are the possible reasons? Yeah, because they are all living with the family members. So Dr. Lee has explained earlier. And then the second question is that the results are surprising and interesting, especially the older group was more likely to feel social connected than other age group. So the similar questions. So any other questions from the floor? I think we can take two more questions. Any questions?
Hi, thank you very much for the very amazing presentation. I think somehow Hong Kong and Korea share lots of similarities when we face the COVID. And I think the study has a very large sample size on mostly on youth and middle age groups. And so I think the results are very interesting. I might have two questions. So the first one might be, the theoretical model you use in the study is it's a partial sequential mediation. Yeah, and when I read through the hypothesis you made, I wonder why it wasn't a double mediation model or a full sequential mediation model. When you see the research model, you can actually link social distancing directly to loneliness. Yeah, that's some of my curiosity. And the second thing is, I think The reason why youth have faced so much stress during the COVID, it might be they have a large demand on social connections. Like they really have a large degree of mobility, they will have to engage in a lot of social interactions. And when the social distancing comes, it affects their mental health and makes them somehow more lonely. In contrast, when we see in the older population, their mobility is limited. So somehow this might explain the results. And I think the most important part of the study is what can we get from the study? And then perhaps, is there any interventions in Korea that have been doing the ongoing on somehow restoring the social connection of the elderly to the community, or yeah, somehow this kind of things. Well, one of the, if I recall correctly, one of the recent trend is actually when we look into the 3 years pandemic, some researchers will look into the possibility of developing more internet gadgets, internet use to connect people during the pandemic. And I think we have a challenge here because we all know aging population may face difficulties using the gadgets. So this might be a direction.
Yes, we agree that we need to, because the key finding was the importance of social connectedness. That was a protective factor for loneliness. That's why we wanted to, in the future, we want to develop their social connectedness through online and offline. But for online, we wanted to make more seniors to learn about digital and increase their digital literacy so that they can meet more people online, or they can do like games online and maybe use more SNS to be connected with their friends and families. So that's what we look for. And I think we agreed that younger people were already wanting to go out and play more, but they were affected by this COVID-19 and had to stay inside, and that affected their loneliness more. Thank you.
There's one last question on Zoom. So how, Dr. Lee, you deal with the imbalanced data about the sample size?
Because we used the quota sampling, so that's why we had smaller sample size for older adults.
Thank you, Dr. Lee and Professor Chung.